Hey, my name is Sky, and I want to tell you a little bit about how medical marijuana has helped me. And to begin, when I was about 11 or 12 years old, I was diagnosed with TMJ, or temporomandibular joint disorder, which is a disorder of the jaw joint. And basically, my jaw joint went from being like this around my jaw, to being curled up like this. So every time I opened my mouth, it would have to go over and over the joint, pop, pop, and it's one of the most excruciating pains I've ever felt. I have not felt the popping since September 24th, 2009, and it's nice to not feel it, but at the same time, it's scary because I know it's going to come back. And before I had my surgery, I would try various different ways to alleviate my pain. Tylenol, aspirin, Aleve, Excedrin, physical therapy for my jaw to try to, loosen up the muscle so it doesn't hurt so bad. Putting rice in a tube sock and microwaving it to put on my face to kind of take care of it a little bit. Cold packs, anything that you could think of. And then when I was about 13 years old, I started smoking marijuana. At first it was recreationally. It's like, cool, this is awesome. I feel great. And then it clicked. I was like, I feel great. My head doesn't hurt. My face doesn't hurt. I'm hungry. I can actually eat. I can stand to eat. And I could sleep. And, if it felt, on the good days, is probably, on a scale of 1 to 10, like a 30. And on the bad days, it was like 50. It was horrible. You could hear me. You could hear my jaw pop from 20 feet away. And that's pain. My jaw has affected every aspect of my life. And the only thing that seems to ease it is marijuana. I didn't want to take prescription painkillers, and not only that, they would not give them to me. And I'm actually really thankful for that now, because I skipped dealing with the opiate addiction. I skipped, having to rely on those physically to ease my pain. Sure, people say that you could be addicted to marijuana mentally, but I guess it all depends on how strong you are. And I don't believe that. I think the only thing that's addictive about marijuana is how helpful it is. It's saved me so much pain. After my surgery, my mouth was wired shut for almost 3 months. I lost almost 40 pounds, went in weighing 90. By the time I had my mouth wired, I was almost at 60. So, no, I'm sorry. Yeah, so no, almost 20 or 30 pounds. But either way, that's still a lot of a lot of weight to have to lose. And the only thing that would help with the pain after the one bottle of pain medication they gave me was gone was marijuana. I couldn't talk, I couldn't eat, I couldn't sleep, I couldn't do anything. And I was so uncomfortable. Going from having an able body to not having an able body. And sure, it's just my mouth, it's just my face. But think about it. Without your mouth, without being able to talk, without being able to do anything, you can't do anything. I was out of work for a year because of it, and it's absurd that I have to be afraid of losing my job and everything I've worked so hard for, because I want to have a safe and effective way of managing my pain. I hate living in fear. You know, I can't risk it at this point because of the job that I have and because of what I have. I don't want to risk it. So I can't help my pain. And if medical marijuana passed in the state of Ohio, I wouldn't have to worry. I wouldn't have to be in pain, and I wouldn't have to be scared. I would be comfortable. And it's a shame that people have taken this and turned it into a war. It was a war on drugs before it was medical help. And it's a shame that there are people who have taken advantage of it, and those people have ruined it for the people who need it the most. Why do we as patients need to be punished for something that somebody else has done? It's not fair. It's not right. We as citizens of the United States of America have the right to our freedom. And my freedom is not being in pain. It's eating the things that I want to eat. You know, a nice big juicy bite of steak or potato chips. Can't even really eat potato chips. My cereal has to get soggy before I can eat it still to this day. And I know that probably someday soon my jaw will start popping again. I knew going into my surgery that it wasn't a permanent solution, but it was better than the pain that I was in. And the pain after was still excruciating. They broke my face from here down. They had to shift my jaw over and back and eliminate my bite radius. I had a 44 millimeter bite radius before my surgery, and now I have a 20 millimeter bite radius. That is to enable my jaw from opening wide enough for it to pop. And it'll happen eventually, and it's scary because that day it's gonna hurt, and the day after that, and the day after that. And once that happens, I won't be able to do my job. I won't be able to talk. I'll barely be able to eat. And it will start dwindling away again. But marijuana helps. Even if I hurt, it takes away the pain. It encourages me to talk and to eat and to sleep and to do, somewhat everyday activities that most normal people do. And it sucks because I know I'm going to have to deal with this pain and this problem and this ridiculousness for the rest of my life. And if I have to deal with this for the rest of my life, you better believe I want something that is going to help. I don't want prescriptions. I'll take a little damage to my lungs if it means that I stay away from opiates, if it means I stay away from the fact of getting addicted to something else. I'll take that. I'm not addicted to marijuana. I can go days or weeks without it. I've gone almost 5 months without it now. So, it's time to stop this. It's time to change. It's time to get the patients what we need. And if you're a patient watching this and listening to this, I know you know exactly how I feel. And I know that my disorder isn't as bad as many other people's, but it is still horrible. It's still something that affects my life in every way. And if I can have something to minimize those effects, I want it. I'm sure you do too. I believe we can do this. And I believe that it's something that would benefit everybody in so many ways. So, thank you. I don't know how to end this, but thanks for listening.